Welcome to Female Founderhood, a podcast for female entrepreneurs who is willing to show us the behind the scene, the blood, sweat, and tears. Why? Because the success stories that we see have given us the FOMO, whereas when we're in the trenches like I am now, I want to hear that I'm not alone, that everyone else is bleeding and sweating and crying just like me. And by the way, I'm your host, Rebecca Leppard. I founded Upgrading Women, which is a marketing agency serving fellow female founders. So my job today is to ask questions that we normally would be too shy to ask when we are networking with, powerhouses. So today I'm going to be having a conversation with Subaila Zia, MD, MBA, FCCP. Okay, those are like the best quote unquote last names, best titles, because as a woman, we almost automatically have to take we first have to take on our father's name and then we take on our husband's name. But if you now have a new last name, which is medical doctor, that is absolutely sexier to me. Subaila founded Telemedora, and she is also the CEO. Now, my question, Subaila, what did you want to be when you grew up? Did you always knew you were going to be a doctor?
Thank you for having me on your podcast, Rebecca. This is beautiful connecting with like-minded women and through Upgrading Women podcast. So, then thank you for this question. Yes, I did grew up thinking and wanting to be a doctor. That was the only thing I knew. However, right after my pre-med exams, I decided that I also wanted to know the business side of medicine.
Mm,
However, at that time, my mom especially thought that it might not be a practical idea to pursue medicine and MBA through the same during the same time, because I
mm.
would not have been able to do justice to either,
Yeah, yeah, yeah.
and it was practically impossible. So say she didn't let me, but once I to do MBA, she allowed me to do. She allowed me to pursue the bachelor's in medicine and bachelor's in surgery called MBBS back home, and which when I came here, we got the equivalency as a medical doctor. And as far as the last name is concerned, I kept my last name, which is Zia, after
Yeah.
marriage as well. So Zia is my maiden name. So I had that
Yay!
luxury to do that.
So tell
It
me
was by choice.
exactly. Let me. Oh yeah, for listeners. So Subaila is from Pakistan, and are you married with a fellow Pakistani as well?
Yes, I'm married to my med school friend. He's also
Oh,
Pakistani.
wow! And but you grew up not in the US. You're now in the Silicon Valley, but you grew up in Pakistan?
Correct. I was born and bred there.
Ah, so you only moved when you're pursuing a, a, a postgrad degree? Is that right?
So I came to the U.S. As a medical international medical student to do electives at Harvard Medical School.
Mm.
I was unmarried. I was young, and there was an opportunity that Harvard started accepting international medical graduates. So I applied, and
Mm.
of many across the world who applied, I got selected somehow. So and then my dad was very excited about it, and he supported me, and he wanted to set and he made it possible for me to come here and do my electives
Wow.
as an international medical student. And then I went back,
Mhm.
and during that time 9/11 happened. And
Mm.
then people told me that us may not be a good idea for a Muslim woman to
Mm-hmm.
be there because of the emotional distress and this lots of other things that were going on against Muslims at that time,
Mm-hmm.
in the media at least. So, but still, my dad told me that, if you are so passionate about pursuing your postgraduate in the U.S.,
Mm-hmm.
I think you should stick to your plan, and good attracts good. So that has been my mantra. So, and after
Oh,
then, I moved to U.S. for good in 2004. I started my residency in New York City in 2005. And so after med school, I had to do 7 extra years of training
mm-hmm.
to be a pulmonary critical care and sleep physician. So after 3 years of residency in New York City, I moved to Connecticut to pursue my pulmonary fellowship at Yale Bridgeport University program. And then after that, I went to New York City again to do my critical care fellowship, and then moved to a rural place to serve, and then went back to school to do my sleep fellowship at Emory University in Atlanta.
Oh,
And
wow.
then after that, I moved to Midwest to start my career as pulmonary critical care sleep physician. And then I became the medical director at a healthcare system. But for sleep medicine. And then I realized that
Mm-hmm.
I was still lacking the business of medicine knowledge. So while working full time, me and my sister would go to Washington University to pursue an MBA, which we did. Actually, she graduated with a beta gamma beta sigma gamma society, which is like one of the highest
Wow.
laurels there. So my parents were pretty proud to see their daughters graduate at the same time.
I bet.
And
I
after
bet.
that, I chose to make a difference. And I
So,
moved to this. After that, the pandemic happened, and yeah, rest is history. We came here.
yeah. No, but I want to know the what it was like being a Muslim girl, unmarried as well at the time, post 9/11 in New York. How was your experience? Is there like the media is just making it too bombastic? Actually, the day-to-day experience is just normal. How was it like?
So for me, it was. I did not come across any kind of discrimination in New York. It was because there was. It just felt like home, because I could see when I started my training. I started it in Bronx, which is one of the poorest counties of New York,
Mhm.
and the crime rate was high at that time, so we always had to watch our back. I did not, regardless of your color, be whether you are, regardless of your background, it doesn't
Mhm.
matter. And uh, I came across nothing but kindness. I
Mm.
was my program director was a Jew.
Mhm.
My and the people, my other uh, mentors, and the ones who inspired me to be pulmonary critical care physicians, they were all Americans, and they were also Catholic and Jews, and they all helped me to get me into one of the best
Mhm.
programs offering visa for my pulmonary fellowship. And they all trained me to the like they were training anybody else. So I was just super lucky. I
Oh,
made lots of friends in New York City, and we still remain friends. So when I went there, I shared an apartment with a person with my friend with a person from Peru. So she was so respectful of my dietary needs that she would not cook pork, or would not drink wine, and would not allow anybody to bring those inside our
at the
mini
house.
apartment that we had at that time. And we
Oh,
still remain friends. So she have yeah so we are it's just like you just find your people, so
yes.
wherever you go. And my dad always tells me that, kindness has no boundaries. So if you are
Mhm.
kind, people will definitely reciprocate it for the most part.
Yes, no, 1,000%. I believe that. Even like I keep telling my team at Upgrading Women, the best sales strategy is just to be kind, because
Yes.
you also want to attract clients, customers that appreciate that kindness. Because anyone can sell any product, right? But the one interaction you remember, if you go to a 7-Eleven just to buy, candy, you will remember the kindness of the person at the till, at the cashier, right? And even
Yes,
if it's like 10 minutes further, you will always go back there. And it's humans are made up
absolutely.
of emotion. We're not rational human beings, to start with. So, okay, wonderful. Now, I have a question. So, I understand that sleeping is probably nearly as important as oxygen. But how did you, out of all the specialties, because I came from a family of medical practitioners. I have aunts who are midwives, and I have uncles who are doctors, and so on. So, talking about health in medical aspect has been my day-to-day activities. But out of the, from dermatology to oncology to everything, why did you choose sleep as your specialty?
That's a great question, Rebecca. So, had somebody asked me in my med school or had somebody told me in my med school that I would be a sleep physician, I would not have known what they are talking about, because in med school we were not trained, or we were it was not taught. Sleep medicine was not taught
Mm,
at that time,
mm,
and even today it's not a huge part of the curriculum. However, this all changed when I started my pulmonary fellowship at Yale University Bridgeport program in Connecticut as a pulmonology fellow. I would see patients who had breathing issues, and at night as well. And
mm,
some of those breathing issues were caused by the closure of the airways, or reduction in the airflow, and that would lead to significant impact on their lives, from having high risk of a stroke, heart attack, anxiety, depression, and so on and so forth. So,
mhm,
and there is always this charm to go into the very flashy fields that are most talked about, plastic surgery,
mm,
and other fields, but when I um, or any kind of procedural fields as an internist at that time. However, I felt that I would be able to impact not only 1 billion lives across the globe if I help
problem.
them fix their sleep problem, because that's the number of people that suffer from sleep apnea and other sleep disorders.
Mm.
And also, I can also impact public safety,
Oh,
because
yeah,
annually there are so many hundreds of thousands of crashes due to drowsy drivers. So
yeah.
that's why I chose to be a sleep physician as well, in addition to being a pulmonologist.
Wow. I think
Yeah,
it's it's just
and I
crazy how.
also want to add,
Oh, yeah.
yeah, I also want to add one more thing, that I felt that everybody spends at least every day few hours of their lives, regardless, sleeping. So that if I'm going to impact this in a positive manner, this is one activity that determines how their next day is going to be, and that makes
Oh,
them feel
yes.
prepared for the next day's challenges. So
Yes, absolutely. It will make or break your day, right? And your
yes.
life if it's long term. And I'm talking to you now. I just recently, and feel free to comment if I'm doing the absolute bad thing. So recently, I have changed my new sleeping habit. So I work from, say, 8 in the morning until 1 or 2 in the afternoon. And then I take like a 3 hour nap. And then I would stay up, do my activities. I have 3 children, I have a business, I cook and clean and stuff. And then I will go back to sleep around midnight and wake up at 6. How bad is that? I feel great because I have like a second shift, and I can work and focus at night without feeling like I'm burning the midnight oil. But is that should I stop this new habit, or is that all right? Do you think?
Yeah, so that's a great question. So as long as and it depends. So as long as your new routine
Yeah.
is not causing you to be drowsy the next day, and it is not causing to lack refreshing sleep.
Uh-huh.
And if you feel that, like you said, that you are not burning the midnight oil,
Mm-hmm.
you may choose to continue that. Having said that, there is um, anybody who takes more than 3 hours, more than 30 minutes nap during the daytime in late afternoon,
Mm-hmm.
they tend to struggle falling asleep at night. So if you're not having difficulty falling asleep, meaning you're able to fall asleep within 30 minutes,
Mm-hmm.
and you are able to get in at least 6 hours or more of sleep every
Mm-hmm.
night,
Mm-hmm.
uh, that should uh, that should give you uh, the bandwidth to perform the next day, because it seems that you are getting in at least in a 24
Yeah.
hours cycle, you are getting in at least
8.
8 hours of sleep.
Oh, I'm so glad to hear, because I have chronic insomnia that if I go to sleep around 9 or 10 at night, which is, how normal people do, but then I would naturally wake up around 3 in the morning, which is annoying. Like, what to do at 3 in the morning? Do you go back to sleep? Or it's not, and you're not awake enough to actually do activities. So yeah, that's my I just recently found this new habit, because one day I had a sore throat, and I thought, okay, I'll just take some medicine and have a nap. And then after that nap, I felt so refreshed that I had no more sore throat. I could work through the night, and I could fall asleep naturally without any help. Because sometimes when I cannot sleep, I would take diphenhydramine, and it's not
Oh,
sustainable,
that
isn't
is
it?
yes, yes, yes. We don't in the US we don't recommend diphenhydramine as a sleep aid.
And over here in the UK, you can go literally, the box would say sleep aid, and the ingredients is diphenhydramine, 25 milligrams at
Yeah,
least.
because in some yeah, so diphenhydramine is not our go-to to help people fall asleep. Here we for a couple of reasons. One is that it has its own side effects, and then second is that patients, especially women who have iron deficiency, which leading to restless leg syndrome, that can worsen the restlessness, and
Mm,
then their legs are more jumpy, or their arms are more jumpy, so that just worsens it. So that's one
mm,
of the other reasons why we don't use it here. Here, most of the
interesting.
one of the most commonly used
Mhm.
sleep aid is, especially for under 65, is melatonin, which is a natural hormone
Mm,
released from the pineal gland
mhm.
in the brain.
I see. Now, let's go back to the hot topic that we discussed just before we jump on this call, which was healthcare. So I come from Indonesia. I live in England with free healthcare. Um, and I think the US is one of the few developed countries with no universal healthcare. How was it like in Pakistan, and how do you find the healthcare system in the US?
Great question. Yes, I've had the privilege of serving
Mm,
um, both
sis-
spectrums the world, of the world. Yeah, I've had and here as well. So in Pakistan, there is when I was training there, and I did my med school there. I did not work at a hospital where it had the common or universal healthcare system. So in the state where I was, there was no healthcare
mm,
insurance. You had to pay out of pocket for
everything.
everything that you would do in a private hospital. In the public hospitals, the government hospitals, as they are called, the government would have a shorter range of the medicines that can be given to you. So if you needed something else, a broad spectrum antibiotic, you would have to pay out of pocket. If you let's say if a patient needs a heart surgery, they may waive off some of the costs, but others would be out of pocket, even in the government hospitals. So there in the U.S., when I moved here, I came to know about the healthcare insurances, and then even in the U.S., I have worked in and trained in different healthcare systems throughout my career here. So I have seen that there is a government payer, which is for people who are above 65. That is
Mhm.
called Medicare. Then there is another government payer called Medicaid, which is for people uh, who make less than a certain amount of money and don't have the means to support it. So our remainder, rest of the ones who have it, they are part of our paychecks goes to that fund as well. So that helps support that program. Our taxes go there, and then
Mhm.
and people who are employed have commercial payers,
Mhm.
so commercial private insurances. So those are the three broad categories of payers. In the US here, though, I have, depending upon patients' health care insurance, certain tests may need prior authorizations, and if a patient has um, another kind of insurance called PPO, they may not have to go through the referral from the PCP. They can just pick up the phone and get in with the sleep specialist office if
Mhm.
there is one available in their area. So that is that. So it does, and then there's always option to pay out of pocket. Healthcare is relatively expensive here. So sometimes when patients go, I remember I went to Arizona for a pulmonary board review course a few years back, and I was not living there. I was just visiting there, and it was in Arizona, and Phoenix was the name of the city at that time. So it was so hot. We were not used to 110-degree temperature there. So even at 6 p.m., I was waiting for the shuttle, and I got so dehydrated. I had to go to the ER to just to seek care, and that one visit with one with 4 or 5 hours of visit cost the charges that came later were $7,000 because they apparently it was out of state. I had to get the IV. They had to run some blood work to make sure that there's nothing else. They had to give me. They still found because of this elevated WBCs. They gave me Augmentin, which is usually $5 over through a prescription here. But since it was received in ED, I received a big bill. And then my insurance picked up some, and as a fellow, I had to put together the means to pay for something for the remainder, which wasn't which was still higher than my monthly
How much did you
paycheck
pay?
at that
How
time.
much did you pay out of pocket then in the end?
And that was, I think, out of pocket was more than $1,000 that I ended up paying.
Oh my God, that is so painful. Like more painful
Yeah.
than the dehydration itself.
I know.
Like, I mean,
The-
for
the-
$1,000, like, no, just leave me dry in Phoenix, and I'm sure
yeah, like-
as soon as I come back home, I'll buy $1,000 worth of water. Thanks.
or maybe I should have just taken a cab. That would have that would have been cheaper at 40 to the hotel, back to the hotel.
Take a cab back all the way to cooler temperature. You know, it's just so
Yes,
crazy.
yes.
Here's the
So
thing: I keep watching, stand up comedy and stuff, and I only know the horror stories from comedians, like how, if you break a leg, it would be cheaper for you to come back home to England in first class with your other leg sitting next to you. So two first class tickets would still be cheaper than the ambulance, plus the emergency, plus the surgery. Is that so? That's not an exaggeration then.
well, so
Not
again,
at
it
all.
depends upon the kind of insurance that you
No,
have, the
not
kind
at
of
all.
so
Yeah.
and also it depends, yes. And so healthcare is relatively expensive in the US, but there's no doubt about it. Healthcare, however, we do have more options here. Um, and we don't, that is number one. Number two is that that's why at Telemedora, I am a stickler
Mm.
about promoting price transparency
Yes.
before patients before it the prices are on our website for each and
Mhm.
every visit, each and every test that
Mhm.
they should expect. If
Mhm.
it's and that is for self-pay patient. We also do, as soon as the patients call us, and if they have an insurance, we do complimentary insurance verification and eligibility with them. Even though it's a patient's responsibility, we still do it, and we share
Yeah.
the results. And then we tell them that, look, this will be this much your insurance will pay, this
Mhm.
much is your going to be out of pocket cost, because either you have not met the deductible or there is some copay to see a specialist, so that they are mentally prepared.
Mhm.
What drives me crazy is that even when I go to get care, I'm more worried about the cost it would have
The diagnosis.
on my wallet, rather than the results itself. So so
It's more like
and that should
what's
not be
the
the
damage?
case.
Oh God. It's heartbreaking, isn't it? And especially for women, and we have more conditions than normal men. So tell me, out of your, on top of your mind, how much money would a pregnant woman have to spend on the day she gives birth in the US?
So there has been a yes, so that's a great question. Actually, I'm not an OBGYN, but I have read, and I'm not a mother too, so but I have read stories about some hospital systems charging, in a few years back, some of them were charging as high as $60,000 to the
$60,000
patients for that. Yeah,
for
and some
one
were
birth.
charging one birth, and some of them were charging up to 20,000 or something. So it depends. Again, it depends on the zip code that they are in. It depends upon the insurance plan that they have. It also depends upon the general other care, prenatal care, or the lack of it that they have received, and the complications that they have had through that process. So that is that's why now here price transparency is being promoted. It is hospitals are required to post these prices online,
Mm.
and the government is cracking down on those which who are not doing it.
So people, I'm just guessing now, people would just walk out of the hospital with a new baby and a new debt. Is that right?
In some cases, yes, yes.
Well, otherwise, who would pay for it? Would insurance pay for delivery?
So insurance does cover delivery,
Mm,
and again, it depends upon the kind. So it does kind of the deductible plan that
yeah,
they have had. So some people, in order to keep their monthly cost low for the
yeah.
insurance, some people opt for the high deductible plan. Let's say $10,000 for the family. So until unless they have met their deductible, only then the insurance will kick in. Some patients, so the first
Yeah.
$10,000 will have to come out of their packet, of their pocket. So that is that. And some people have low deductible plans, so then they pay. It's just like car insurance. So when you get into a car accident,
Yeah.
sometimes you have to, if you have a high deductible, you pay for it first before the insurance kicks in. So that's how some insurance plans
But that's the
are
thing with an
designed
accident.
here.
But that's the thing. An accident is an accident. A pregnancy, yes, it can happen accidentally as well, but it's like it's part of life. It's to be expected.
Yes.
Oh my god, that gives me a headache because I have three kids. If I have to, and I gave birth all three of them through C-section, I would be bankrupt if in whatever scenario it is, you know. But anyway, so was how did that, working through all various system, all the, what do you call it, frustration of practicing medicine in the US, how did that lead to you founding Telemedora?
Yeah. So, first of all, being a physician is a privilege. People share their stories, their intimate problems with. So, regardless of which part of the world you are, however, walking through and navigating through the uh, web of insurance and payers can
Mm,
be tricky. So, when I was employed, I did see that patients had to make choices for what kind of tests they would
mm,
want to get, and sometimes the tests get denied. So let's say if we order an in-lab sleep study for somebody because of the complexity of their sleep disorder, the insurance company will deny it and say, no, 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 this patient can should start with a home sleep apnea test first, which is few $100s as compared to thousands of dollars for in-lab sleep study. So, and then if you are very passionate about it, you have to call the insurance companies to try to fight that denial. Sometimes I have spent more than a couple of hours of trying to talk to them, and those hours are unpaid by the we as physicians, we don't get paid for
mm.
spending that amount of time on the phone, and it has to be done after our hours. And sometimes they still would deny it. I've had patients who needed a PET scan
Mhm,
to work up their lung masses or
mhm,
for possible malignancy. They would also get denied, and then I would have to find time either during my lunch hour or my after hours to try to fight it. And so that's a whole other that is also very frustrating, not only for us as physicians but also for the patients, that they are
mhm.
that their fate is being decided by their payers,
Yeah,
insurance companies. So yeah.
it's crazy. And then how did the idea
Yeah.
of Telemedora come about?
So the idea of Telemedora came about because as I noticed how long were the wait times for people to get in, especially from in rural areas and or remote areas, to get in and see a sleep specialist. So just to put things into perspective, there are 1 billion people across the globe which are affected by sleep apnea, um, and only in the US, there are estimated 54 million people who have a sleep apnea. That is just one sleep disorder, in addition to, and there are many more with other sleep disorders.
That
And
is
in order to take care of,
that is diagnosed. What about the undiagnosed? There
yes,
must be
yes,
more,
that
right?
is undiagnosed, yes. So that was even higher.
Yeah.
And then in order to take care of those people,
Mhm.
for every 46,000 US, for every 46,000 Americans here, there is only one board certified sleep physician to take care of them. So imagine the shortage
Yeah.
and the demand.
Mm.
So that's why we said that, it's ideal to have a startup which caters to these needs, which
Mm.
allows people to get in sooner,
Mm.
instead of waiting for weeks or months or even years. In some cases the wait time is long, and also allowing people to get the care in the comfort of their own bedrooms. So,
Mm.
and which is continuous, which
Mm.
is affordable, which is transparent, and which by all means is the same quality of care that they would have received had they traveled all the way
Yes.
to see a sleep physician. So that's why I left my job as the medical director of sleep medicine in a healthcare system, and I was also serving as a pulmonary critical care sleep physician
Mhm.
in Midwest, and moved to Silicon Valley to start this digital healthcare startup called Telemedora.
Wow. Yeah. Now my follow-up question to that is, how easy or how hard was it for you to get this up and running from ideation to actually accepting patient?
I would say that it is a highway made up of dreams, tears, sweat, aspirations, and lots of sacrifices. So,
Yes. Tell me,
so
tell me
that
the war
is,
story. So you started this
yeah.
almost 3 years ago, right? How
Yeah,
was it
we
like?
started this in 2021. Yeah, we
Yeah.
started this in 2021, the pandemic, and in order to get the paperwork up and running, everybody was working remotely in California at that time. So, by remotely, I mean that even if we would send in our application for the paperwork, it would get to that government office, but there was nobody to review it because they were at home, and they would have to, so the things which would have technically taken 48 hours
Mm.
somehow took 4 to 5 months to come through. And then unless that paper didn't come, you could not apply for paper number 3 and stuff like that. So
Mm.
that did delay that thing. There's something called Murphy's law. So that is, whatever can go wrong will go wrong. So initially, that was when it came to the paperwork, that was how we felt. So that did eat up lots of our initial time.
Mhm.
And then we were bootstrapping, meaning we are
Yeah.
self-funded. We did not seek funding,
Mhm.
because I wanted to have a skin in the game. I wanted to customize it according to the vision that I have in mind, that how a patient should be treated and cared for.
Mhm.
So that is that. So we had to stay very lean. I had to learn how to do
Everything.
non-clinical things, and to keep the oil in reserve, and
Mhm.
that has paid off. Now we were just in one of the top 12 finalists at a global telehealth competition recently, I think last week
Mhm.
or so. And so we made it there. It's a big thing for us that we
Big.
were able to be in the finals of that, along with Netherlands and companies from Nigeria, or companies supported by the governments of some countries.
Mhm.
So
Mhm.
that's a big thing. We are now gaining traction. We are already in network with the government payer called Medicare, and now we are have started accepting other insurance plans, especially in California, and
Mhm.
we can see patients in 4 more states apart from California: Illinois, Indiana, Georgia, and Pennsylvania, and bring them the care that they need.
Mhm.
There have been lots of lessons along the way, and
Mhm.
it has taught me to be more resilient. It
Yeah.
has taught me not to take no for an answer
Mhm.
and
Absolutely.
keep trying.
What was the biggest
It
no?
has taught.
Biggest no you experienced?
Mhm.
What was the biggest
What
no?
was the big?
The biggest no.
So yeah, so biggest no I would say was, well, there are too many. So
Exactly.
I
I
don't know
mean,
which one to call
um,
call
so
the biggest one, but
you had to apply for so many licenses, right?
yeah, so the licenses wasn't that the biggest. The biggest no was that we initially tried to cater it to the healthcare systems, which were looking to fill the spot for pulmonology for many years. But so they are, and even for sleep specialists, and some places where the wait time is more than 1 year. So
Mhm.
we tried to fill that gap. We tried to collaborate with them, and somehow, because of the hiring freezes and also because of the overall instability in the healthcare market right now, they that B2B didn't take off as much as we would have
Mhm.
wanted, especially for telemedicine.
Yeah.
So that is still a work in progress.
Mhm.
However, we have been able to cater to them by providing in-person services to them,
Mhm.
by serving their patient population in person on their own sites, for pulmonary and critical care and sleep medicine. So yeah, but not through not the way that I had envisioned it.
Mhm.
Having said that, I would say that we pivoted to just focus on B2C, meaning patients directly from between physician and patients, and that has surprisingly been doing very well, and we hope to gain more traction. So yeah, I think God put me on the right path here.
Oh yes, absolutely. Now, how was your? I want to know. It was in the middle of the pandemic, where nobody in their right mind, and I tell you, every entrepreneur, they don't have the right mind. We don't have right mind. We are just crazy. If we're not crazy, we won't be doing this anyway, right? So, what went through your mind that you wanted to quit your stable job in the middle of a pandemic? Plus, you're a doctor. It means you're um, taking yourself away from the lives that you could have saved on a day-to-day basis. Even though, yes, of course, this is a long-term life-saving company as well. And moving from the Midwest to California to Silicon Valley with a completely different culture, completely different environment, and that you had to take your husband with you as well. So
Yes, yes.
how was
So
it?
that's a
You
great
had your
question.
own you
That's
had
a
your own
great question.
pandemic.
So this we have been, yeah, that's a great question. I wanted to, so this was not this idea was not only during the pandemic. So I had been harboring this idea since 2015 when I was in my
Right.
fellowship. I saw the first telehealth program go
Mhm.
live at VA in Atlanta.
Mhm.
But however, when I graduated, I joined a private practice. I didn't, but then the distance to travel it back and forth between my sister's place was more than 4 hours, and so that didn't work out. So I moved to another, uh, much closer healthcare system there, and then I figured that if I need to have a seat at the table, I
Mhm.
need to get better at understanding the business of medicine. So that's why I pursued MBA,
Yeah.
and I was also the medical director of sleep medicine there. So I also learned the nuances of and the headaches that go be leading a ship there.
Yeah.
So that also happened. So in 2019, when I graduate in December 2019, when I graduated from my MBA, my plan was to go give my resignation and start this. And then the pandemic happened in
Like,
March 2020. Everything was shut down.
yeah,
We were already short staffed at that place, so I
yeah,
didn't feel right to leave at that time. And the
yeah,
pandemic was raging. There was
yeah.
no vaccine. There was nothing. So I took care of patients in the
Mm.
ICU. We had no masks. We used to had the
PPE.
same. Initially, there was a shortage, so we used to have the same face shield for months that we would clean. And we were just using these masks very like they were gold. And we had to have the yeah, because there was shortage of the personal protective equipment there,
Yeah.
all across the world, because we were not mankind was not prepared for this pandemic. So we did what we needed to do until the first wave was dying down. And at
Mhm.
that time I said, it's time to take the leap of faith. Now we have saved lives. We have now the PPE is uh, available now. The borders have opened. People can travel. The Also, there is now a vaccine that is going to be out in the market. So at that time we said, maybe, and we didn't know that in 2021 that pandemic would continue. So at the end of 2020 we moved to Silicon Valley. And my
Mhm.
spouse I just had to share my dream with him, and he wholeheartedly supported it. So that's how it happened.
And so your spouse is a medical doctor as well, is that right?
Correct. So I didn't even only move with my spouse. I also moved with my sister. So my sister is also a medical director, a doctor, and she was the president of the medical staff committee at that
Mm.
place. And she was also serving as a hospitalist
Mm.
at that place. She also had several other leadership positions, like she was the physician advisor of the entire healthcare system. So we all decided that in order to make a difference, we had to move, and either we are in it or we are not. And sometimes,
Mm.
and the way my contract was designed was that I could not pursue a side hustle
Yeah.
um, without quitting. So that was my only
Yeah.
option
Yeah.
there.
Wow. So literally, so it's not only your leap of faith, but also your sisters and your husband,
Yes,
and the three
yes.
of you took the plunge together. So how did you
Yeah, I
decide?
started the plunge, and then I started the
And
plunge,
they
but
have
then
to
they
come with you.
decided to join. I said, I'm in free fall. Come join me.
Join
They said, as if
me.
we have an option.
And so
Yeah,
how's the dynamic? So the three of you had security before, had position titles and status in the community, and now you're like basically you're now the same like all the the tech startup crowd, right? And you're obviously
so
more senior and more mature than them. And but being in this new
so
environment, how's how's your mental state?
yeah, so great question. Great question. So my spouse is currently employed with the healthcare system here. He's not
Okay.
part of the Telemedora.
Okay.
My sister has her own startup that she is focusing on that deals with other pain points in healthcare.
Uh-huh.
So, because there are too many points to address,
Yes.
so Zia sisters are doing it.
Oh gosh.
So she works there, and then she also works as a hospitalist too.
Mm,
So those are the things that she has keeps them busy. So I get to run the show at Telemedora along with my team,
yeah.
and my family is there to support me emotionally and
Yeah.
psychologically. if
Oh,
you
absolutely.
so if I need it, yeah.
What have you found out about yourself? I mean, you have been an alpha female all your life, right? You have, and you're lucky enough, as you said, that you have a supportive family back home. You've never been, your growth has never been, you know, stopped or capped just because you're a woman, just because you're a Muslim, just because you're a brown girl. And now, and it's all proven so successfully. You've got all of the degrees, all, it seems like God opens your door. And entrepreneurship is completely
Yes.
different ball game, right? And what have you learned about yourself? Like, oh, I did not know I'm like this, or I can do this. How's your journey so
Well,
far?
my journey has been very rewarding. And I did not know that I would get so much support
Mm,
from people that I wouldn't expect to support me. And so it did, yeah, it did. And I got to connect with so many wonderful people, be it males or females,
mhm,
uh, and regardless of the caste, creed, or color. Just to give you an example, a couple of years ago, we were very new. We were still in 20. Um, or maybe last year, yeah. So I think last year, what happened that we were supposed to be at a festival to have a booth for Telemedora.
mhm,
So everything was set in plan. All the paper, everything that needed to, everything was paid for. Everything at the last minute, the person who was supposed to move those tables and those the tent poles which
mhm,
had lots of weight,
mhm,
he had some emergency and he bailed out.
mm,
So, and here I am at 7 p.m. the morning before the festival, which we have paid for out of our pocket,
mhm.
and I have nobody to move me. So out of nowhere, my one of my friends texts me, "Hey, Subela, what are you doing this weekend?" I said, "Well, I was supposed to be at this festival. Do you want to come and join?" She said, "Yeah, but you sound very you don't sound like the chirpy Subela that I can't stop." So I said, "This is what happened." She said, "You know what? Me and my spouse would be there tomorrow morning at 5 to help you move." I said,
Mm,
"Okay." At 5, we all get here. She brings her car. Then it turns out that the things are too long for her and my car to be put in. And at the same time, somehow other I had my other friend who is an engineer who by the stroke of luck brought his big car that day. So he was also going to the festival for his company. I said, "Oh, you are going to? It seems you have some space." He said, "Yeah, what do you need?" I said, "I need to bring all that." So we get there, and we got there, and as soon as we enter there, the organizers tells us that the person, although you have paid for the lowest possible
yeah.
sponsorship spot,
Uh-huh.
somehow we want to upgrade you without or for no charge, because the other company that was supposed to be there is no longer coming, and we don't want that spot open. Would you be willing to take it? So that's how God puts places together.
Yeah.
So 12 hours ago, I was without any help. 12
Yeah.
hours later, not only did I have help, but I was able to score a place where without paying for it. So I feel that luck has to be with you. You have to have the right people, and I feel like I have gotten better at networking. I didn't,
Mm,
because of my job and my other responsibilities. I always found an excuse not to go
mm.
somewhere, but I feel now I have gotten better at networking and maybe branding. I'm learning how to brand myself.
Yeah, absolutely. And do you feel like in Silicon Valley, um, female founders have more um, trouble branding themselves, inserting themselves into the best position in the room, the best program, accelerator, etc. Is that right? Because what I can see only is the statistics that female founders don't get enough funding. How's your experience been?
Yes, yes. So we haven't started raising yet.
Mhm.
Having said that, you can. I have been to the events, Rebecca. It just becomes. So one of the events I went to last year. Last year, I never take my spouse with me because he has his own job. So
Mhm.
by somehow it turned out to be um, an event where there was this Desi community there, meaning there were people from South Asian background. So I said, you know what, there'll be, it's a Saturday. If you want to come along, you can come along. It's there. If you have nothing better to do, that was his cue. You better come. So he said,
That's
yes,
an
yes,
Asian.
yes.
That's
So
an Asian invitation.
so we went. That's a subtle way of saying that please this is do come. So he came, and when we entered there, I saw this big circle of founders, all males, standing there in a closed circle. And there was, so my spouse goes there, and me and my sister, we were and there were two more female founders standing at the very corner of the entire hall. So me and my sister walked there, and I asked him, "Hey, we introduced ourselves." He said, "We are happy to be here. Why aren't you guys there?" She said, "They said that there's no place for us in the circle." I said, "You know what? Instead of making your own circle, let's blend in that circle." So she said, I if you want to do it, yeah, but because there are so many there, there was this hesitation. What would people think, that she's being intrusive?
Mhm.
And then what happens is that my spouse, he starts calling me that, hey, come join the circle. So we, all four of us came.
Mhm.
We all joined, and we in the circle, Rebecca, what was happening, everybody was sharing what they're doing, the why, and they
Mhm.
were introducing themselves. They were so we had the opportunity to meet with potential vendors, potential
Yep.
stakeholders.
Yep.
Had we not, so had he not opened the circle for us,
Mhm.
I would have gone anyways. But I'm not sure about the other two
Yep.
women there. I would have gone and taken my
Mhm.
sister there because I just want to be where the action is.
Yes, exactly.
So but we do need people who to open the circle for
Yes,
women.
exactly.
We do not only want to talk about diversity, equity, and inclusiveness. We need to be embracing it. We need to be celebrated. So that's what I have felt. And the funding statistics have been very alarming as far as
Yeah.
female founders are concerned. You're right. Less than 2.5% of the venture capital
Mhm.
funded startups are
Mhm.
founded by women,
Mhm.
and most of the minority funding is even less than 1%
Mhm.
of those 2.5% funds.
Mhm. Mhm.
So I'm sure that we are going to I wouldn't be surprised if we are going to run into issues in that regard. But every time, every challenge gives me the courage to up my game a tad bit more.
And
so
what
so that's
from your own observation, why do you think that is? Is it because there's just so much bias during the pitching, the networking, or even the access to information, to network, etc., is just so um, exclusively tech bro? What's your observation?
yeah. My observation is that, like you said, you in your question, that somehow we just don't know where to be. Okay,
Mm,
so we don't know where so and we don't, as women, we have other responsibilities too. So
yeah.
we are taking care of the household, we are making appointments for our we have to be cognizant of our parents, our their needs, our kids, who those who have kids. I don't have kids,
Mhm.
but our spouses. I mean, we all want to be super women somehow. and in the whole process we stop being kind to ourselves. So
Mm.
and we don't we whatever time is left, we don't want to spend it in networking. So I feel that women need to take a little bit more risks, calculated risks. They Because we are also somehow, I have seen that we can be a little bit risk averse as compared to men, because they have so much access to funding, so
Yes.
they get funded more easily as compared to women. So yeah, I think those are the two main things that we need to break
It's a
the
vicious cycle, isn't it?
break the ceiling to, and break the circle.
Yes. And this is my last question before my last question. You mentioned a few times how your husband has been very supportive. Um, if you could give advice to female founders who are still single and they're trying to vet and see red flags, what would your advice be for female founders to find the right spouse? Because to be a spouse of an entrepreneur is a completely different ballgame. So, what's your advice for new
Yes.
women out there?
Yeah, so I have been married for 15 years.
Wow.
Now, I have known my spouse for, before getting married, I knew my spouse for 7, 8 years in med school.
Yeah.
So one advice that I would give to them is that, uh, you know, go for the guy who is not only not only respectful, loving, but who's strong enough to see you thrive, who does not have
Mm,
an ounce of jealousy when he sees you successful, when he sees you winning laurels, when he sees you going after master's degree, when he sees you going for artificial intelligence certifications at MIT. He should not get insecure. He
mm,
should he should not pull you down. They should. And the second one is that you have to make sure that you stay financially independent. There is absolutely no second thoughts about that. As long as you are financially independent, you are strong, you are powerful, you can make choices, you can take risks at your own cost. Because
mhm.
it is being about, and you it is being fair to the other partner. And the third thing is that if you chose this path of entrepreneurship, don't expect them to join you. Let them pursue what they feel like pursuing, what they love about doing. It should not be a punishment to marry strong women. Be kind, be respectful. There are times when things won't be as rosy as you may think about. There are times when your spouse will also make some decisions that you may not totally agree with, but still respect them. Find a way to love them. So my spouse found me. I didn't find him. So we were in the same clinical group,
Mhm.
and he is very different than who I am, but he is very persuasive. So he kept persuading me for many years. I came to the US first, and he wanted to know if when I am coming back. I said I'm never coming back. I'm here for good. And he had taken exams for the Pakistani government post graduation exams. He had cleared them. He had started working in the hospital. Then he switched. Then he said, "Okay, wait a minute. You're not coming back? Never?" I said, "No, never." So then he took all the USMLE licensing exams, he pooled his funds, and then he applied. And then he eventually came years later, and he joined me. And after he had the residency, only then we got married.
Wow.
So love should not be blind. Use your mind too a little bit.
And money.
Yeah. So
Oh.
my spouse comes from a very humble background. So I
Mhm.
had, by all means, he came from exceptionally humble backgrounds.
Mhm.
I did not care if he had money or not, because my
Mhm.
dad told me my daughter is strong enough to have her own means and live a life that she wants. So, and
Mhm.
he groomed me for that. So that is that. And he also did not come from the same language, same thing. So we came, and his culture is in our in-laws. The culture is that very they wear scarves and they wear the abayas.
Mhm.
They are very conservative,
Mhm.
but he never asked me to follow those, because he knows who I am and
Mhm.
what I I feel comfortable doing and what not. So I respect his desires and he respects mine.
Wow. That is so
So
refreshing. And I think the fact that he doesn't give you any ultimatum saying you have to come back home, you have to wear hijab and this and that. I think that is the winning point, isn't it?
yeah, because I did not give him that option. That, and he also, and when I remember when we were getting married in New York City, we got married in New York City. So when we were getting married in New York City, first you have to have this marriage license.
Yes.
So in this marriage license, this lady asks, and that was my first marriage license ever. It was my first marriage. So that lady asks that what would be your last name? I said my last name is my last name. Zia is my last name. She said, no. After marriage, what would be your last name?
Mm.
And I repeat this. And then now this lady is getting worked up, and my spouse could see it. And she says, lady, I'm asking you, what would be your last name after marriage? Are you going to take his last name after marriage or yours? I said, why would I change my name? It would be, I love my dad's name. I'm his daughter. Just because I will become his wife doesn't get to delete his name.
Mm.
And my spouse said, yeah. So this lady asks him, what would be your last name? And then my spouse is confused. He said, do you want my last name to be Zia as well? So she says, no, you get, if both of you are keeping, so let me get this straight. You will keep your last name, Subaila? I said, yes. So I got to keep my last name. He gets to keep his last name. So that's fair.
Yeah. I mean, that's what I don't
Yeah.
understand. I think it's very much like a transference of possession. Like a girl
Yeah,
used to do,
absolutely.
right? It's like a transfer of property, like when you sell your car. So now the car is under someone else's name, right?
Yeah, that's a unique analogy. I never thought of it like that, but yes. Yeah.
So
Um,
annoying.
yeah, one thing also helped, though, that in Islam women are not supposed married women are not required to take their husband's last name, so that did help.
Yeah, because you're still Binti Zia. Is that right?
Binti Zia, correct, yes.
That's beautiful. So, okay, my last question is it's a hypothetical. If Subaila is the king of the world, what would that world look like? So, complete this sentence.
Wow.
When I'm king.
Wow, such a yes,
Big question.
such a beautiful hypothetical question. Oh, wow. So, as a female physician startup founder, when Subela is the king, um, she would build a kingdom driven by a blend of compassion and innovation, a kingdom where no one has to wait to get the healthcare that they need, where no one has to worry about the cost of the healthcare that they would accumulate once the healthcare is provided, a kingdom where there are no motor vehicle accidents due to drowsy drivers on the road, a kingdom where no one suffers from depression or anxiety due to untreated sleep disorders, a kingdom where everyone treats others and gets treated by others in a kind and respectful manner,
Mhm.
and a kingdom where diversity, equity, and inclusiveness are celebrated and embraced.
Mm.
And a kingdom where no one dies of heart attack, stroke, or other sleep issues due to untreated or suboptimally treated sleep apnea. And last but not the least, a kingdom where AI powered wearables, nearables would make patient care journey and user journey more friendlier. And the list goes on and on.
Oh yes. Oh, I want to live. I want to live in Zia Kingdom. Oh my god, I can imagine. Zia Kingdom. In every corner, there's a California king bed and a sleep mask, and self-driving where you can
Yeah,
charge
absolutely.
yourself in the car, and then you get to your destination feeling refreshed and ready to take on your responsibility. And isn't it beautiful that if everyone has good quality sleep, I think the world will be in such a different dynamic, don't you think?
Absolutely. If we just give people the ability to rejuvenate,
Mhm.
refresh, and regenerate by getting adequate amount of sleep, they are
Mhm.
able to tackle the world the next day in a much better way as compared to those who do not have. Because there was a study that just came out. It showed that even middle-aged men with no other diseases,
Mhm.
if they only had untreated sleep apnea,
Mhm.
they were at high risk of having Alzheimer's dementia. And
Mm.
untreated sleep apnea was also found to accelerate the aging process as well. So those are the two things that, apart from other issues that are associated with untreated sleep disorders, like having high risk for cancer, having high risk for diabetes, having high risk for having a stroke, irregular heartbeat, erectile dysfunctions, decreased libido, mood
Mhm.
disorders, poor performance at work. They are a, if people can only address these issues in a timely manner and bring it to the attention of their physician in their short appointment time that they get,
Mhm.
they are going to live a much fulfiller and healthier life.
Oh yes, amen to that. I want yes to all, yes to the above. Like, and this is why I so believe in the term beauty sleep, because yes, there's no way even the prettiest people on earth will be able to look pretty without
Yes.
adequate sleep. And on that note, I'm gonna have to end this conversation because I can talk to you all day until I fall asleep. Thank you so much for
Thank you
being
so much.
here. I wish everything that you said to come to fruition, and I look forward to Telemedora being fully funded so that your growth could be supercharged, so everybody can have some recharge in their life. Thank you so
Thank
much.
you so much. Thank you so much for
Yeah, absolutely. And everyone, I'll see you in the next episode.